Now, more than 500,000 people die from malaria worldwide, and Nigeria still has the highest number of cases and deaths. World Malaria Day is drawing attention to control strategies deployed by affected countries. And our correspondent Abimbola Agbebiyi takes a look at the various interventions made so far.
It begins with a bite from a female Anopheles mosquito. The malaria parasite enters the liver cells and multiply. The cells eventually rupture and release more parasites into the blood. The Plasmodium parasite is known to have killed hundreds of thousands of people, and Nigeria records more cases and deaths globally.
Malaria cases are seen, I'm sure, in every hospital of all capacities daily. It's certain that a day do not pass by without seeing a case of malaria in children, whether the uncomplicated or simple cases, as we'll put it, or the very serious cases that that most times end up in death.
The global burden of malaria lies in Africa. The most vulnerable are children and pregnant women.
I've seen quite a number of children die from malaria. The story of a child readily comes to mind. He's around 6-7 years now. He had a very bad form of malaria, the one we call severe malaria. Severe malaria because he had some other organ damage. So severe forms of malaria can affect the brain, can affect the kidneys. It can affect different organs in the body. So for this child, he had what we call the acute kidney injury, for which he needed dialysis. So so while he came out of malaria, malaria was treated, the complications lingered, and we eventually lost him. So that's really a sad story. If he had presented early enough, the death could have been salvaged. So,
a 41% reduction in the incidence of malaria was recorded globally in 2000 and 2015, but an estimated 260 million new cases and 445,000 deaths were later recorded, mainly in sub-Saharan Africa. The statistics had since increased. Countries like El Salvador in Central America was recently declared malaria-free by the World Health Organization. The country has not recorded any indigenous case of malaria since 2017. Half the global malaria-related deaths in 2019 were in 6 African countries. Nigeria presently tops the list with 23%. 76% of the population in Nigeria still live in high transmission areas characterized by the presence of the vector. Unkempt environment like dump sites, clogged drains, stagnant water at their breeding sites. Lagos alone generates more than 13,000 metric tons of waste daily, and acts like this have continued to frustrate global malaria control efforts.
If we want to change the narrative and reduce the incidence of malaria in Nigeria or in Lagos, we must change our habits. As a ministry, we have traversed the whole of Lagos, and we've discovered that our people are not, they are not careful in the disposal of waste. It's still going inside the drains. And when you dump this refuse into the drains, the flood cannot move, the water cannot move. What you have is millions of mosquitoes, millions, billions, because mosquitoes can breed billions. And people will pay for it. That's why we are the largest consumer of chloroquine or anti-malaria drugs, especially in a coastal city like Lagos, where you have rainfall, maximum rainfall.
One vaccine that has proven effective and certified by World Health Organization is Oxford vaccine. It is the first to meet the WHO goal of 75% efficacy against the mosquito-borne parasite, presenting a possibility of reducing the death toll of the disease globally. Several interventions were made by the World Health Organization after the production of the first malaria vaccine, which survived various clinical trials, but not much progress has been made in the 3 African countries where the vaccine is being administered as a pilot program. A Nigerian philanthropist and founder of a malaria eradication project has a different approach, aside plans to develop a malaria vaccine.
Whatever it is that causes the escalation of malaria, cases of malaria, we know what they are. It's just for us now to work towards targeting them. Waste management is the #1 solution, and it's a short-term solution. It's something that can be done now. Vaccine research is a long-term solution. Currently, we have heaps and heaps of dumps everywhere. We must look at permanent solutions. And the first one is sanitation. And what this means is waste management, where homes and offices and streets are properly managed in terms of waste disposal and collection. What we are proposing is that every local government area must have a recycling plant. These plants will be sustained for as long as there's Nigeria, as long as there's life. Because this is what happens abroad. What happens in other countries. Why can't we do it? Why can't we have plants? They don't cost an arm and a leg. Plants are technologies that can be assembled easily. And it will create so many jobs. In Nigeria, we can have no less than 5 million jobs created from managing waste, from the collection points in our homes and offices and streets to the recycling centers. The waste management in our societies, whether it's in Africa or Ghana or Kenya, is so not organized the way it should be.
His recent visit to Antarctica in South Pole, where he mounted the Nigerian flag and as the first African to visit the cold region, was one of the malaria control strategies. Efforts are being made across the world, but the effectiveness in eradicating malaria still stands to be challenged.
But most of the cases we see, particularly in these tertiary institutions, are complicated cases. Cases that were not properly treated or presentation was late, and that's of course commoner in children. People, for example, you're supposed to use insecticidal net, and you find that sometimes it's very difficult for a lot of people to put their nets, and one of the reasons they do give is because when they use that net, some of them say they feel hot. And then we look at also the economic factor, where a lot of people really are poor and there is no power. So it's more like an interplay of those factors. One, a lot of people really are poor, the environment is dirty, and 3, they don't actually do the normal thing they're supposed to do, which is sleeping in insecticidal net and then presenting early. A lot of them don't even have money to present to healthcare facility. They rather go and use Abu and all of those things.
Among these interventions, the need to reduce mosquito breeding grounds still takes precedence. In the last decade, 9 countries across the world were declared malaria-free by WHO. The most recent recipients of the certificate are Algeria and Argentina in 2019. The other countries that eliminated malaria in the last decade are Morocco and Turkmenistan in 2010, Armenia in 2011, Maldives in 2015, Sri Lanka and Kyrgyzstan in 2016, and Uzbekistan in 2018. But with unhealthy practices, many believe it might take Nigeria years to join the list.
Vaccine development, proper waste disposal culture are some of the key areas Nigeria is giving most of its attention to. But medical experts believe urgent action is needed to get global response back on track, and ownership of the challenge lies with countries mostly affected by the disease.